I'm Haley. My speech is on the nursing process. Do you know or understand how nurses initially take care of patients? The nursing process involves assessing, diagnosing, planning, implementing, and evaluating. I will explain to you how important this process is and what happens during each step. The assessing is the first step in the nursing process, and it involves investigating the patient for illness. We want to check our patient and make sure we can figure out whatever is going on and why they are in the hospital. Being accurate is very important for the health and wellness of your patient. You don't want to have your assessment be wrong, inconcise, or incomplete. There are 4 different types of nursing assessments: initial comprehensive, focused, emergency, and time-lapsed. Initial comprehensive assessment is performed shortly after the patient is admitted to the hospital and used to collect all data on the patient's health. The focus assessment worries about one topic at hand, which means we are gathering data for a specific problem, such as pain in the right shoulder, within the assessment as a whole. We also have an emergency assessment that is performed to identify life-threatening problems, such as a heart attack. We have to be quick and complete and concise in this type of nursing assessment because it is going very fast and you are on a clock. Now, you also have a time-lapsed assessment, which is almost the opposite of the emergency assessment. This goes over a certain amount of time and is performed to reassess a patient's health and make any revisions in the plan of care if needed. Now, after you're done assessing the patient, you might find yourself able to diagnose the health problems that may be occurring based on the signs or symptoms. Diagnosing is a critical step to the nursing process and making people better. It is identification of the problem, and in order to treat someone properly for any illness they may have, you must first have a diagnosis and know completely what is going on inside or outside of the body. Now, in order to diagnose someone with an illness, you must create a list of possible problems and diagnosis. You then go back and you eliminate the ones that do not fit. And at the very end, you should be able to come to a conclusion and diagnosis to treat the patient with the care that is best for the position that they are in. There are also different types of nursing diagnosis that is very important to know the difference between. The nursing diagnosis, we also have the medical diagnosis, and collaborative problems. Now, the nurse's diagnosis is solely based on the nurse. This is something that the nurse can do, which is required to find the patient's weaknesses and strengths. This is getting all the information in the very beginning before the doctor is coming in and seeing them. Now, the medical diagnosis is done strictly by the physician. This is determining a disease or illness, and that coincides with the signs and symptoms found in the nursing diagnosis. Now, collaborative problems are when they are always managed by using interventions that were prescribed by nurse and physician. They always require teamwork between the nurse and the doctor, which is why it's called collaborative problems. They also obviously want to avoid any mistakes or problems between the plans of care, so that is why the nurse and physician both collaborate together and make sure that the plan of care is absolutely necessary for the patient. Now, after diagnosing the patient, you want to make sure you start making a plan of care. This is when you come up with what you're going to do for the patient to make them feel better. This is going to find the care that will lead to the maximum outcome. That is what you obviously want for your patient, and evaluate patient's response to nursing care. Now, there are goals that we keep while planning our treatment route. That's going to be identifying expected possible patient outcomes and unexpected ones. You always want to make sure that you plan for what could possibly happen, even if you don't expect it. Now, as always, after you make a plan, you do something about it, and which is what we call implement. Implementing can be done in many different ways, but it is the way that you implement that is the most important. Nurses implement their plans for many reasons, and this is to promote health and prevent disease and illness, and helping the patient achieve important health outcomes. They're there for a reason. You want to make them better. We implement the healthcare plan because as nurses, we need to educate and promote self-care to our patients and let them know what we're going to do to help them. Before implementing, the nurse should always make sure they have all their materials organized, prevent any errors, and teach the patients. Now, of course, after implementing, you want to go back and make sure you have everything correct. Evaluating is the last step, and it makes sure that everything is going smooth with the patient and the plan of care is working. You want to make sure that you work out any kinks in the plan, anything that may not be going as planned, and then you go back and change it. That's what evaluating is. Now, as the conclusion, so the nursing process is complex, but it's very necessary in the nursing world. I am very glad to say that I'll be having to use the nursing process every day for the rest of my career. And this is important because in order to treat any patient, we must get all of the information, which means going step by step and carrying out what we are to do to make our patients better and get them back on their feet. The process allows nurses to give the best health care they can. In order to treat any person for any type of illness, you have to know how to use this nursing process and assess, diagnose, plan, implement, and evaluate everything they document on their patient. Without the nursing process, the nurses we look to for help and comfort would not be able to do their jobs properly or consistently. As a student nurse, I'm glad to say that I'm going to be using this for the rest of my life. Thank you.